Hello, everyone. My name is Wandi Bruine de Bruin, and I'm a Provost Professor of Public Policy, Psychology, and Behavioral Science at the University of Southern California. Today, I'll present on the role of confidence and knowledge in intentions to seek care for hypertension or not, with evidence from a national survey. This is a project I worked on with Yasmina Okan, Tema Krishnamurti, and Mark Hoffman, and we acknowledge our funders at the National Institute of Aging, the USC Center for Economic and Social Research, and the USC Schaefer Center for Health Policy and Economics. So, as you may know, hypertension refers to high blood pressure, and it's a silent killer that damages blood vessels and leads to heart disease and kidney disease, among other things. Hypertension will affect most people in their lifetime and becomes more common as we get older. Therefore, the American Heart Association communicates cutoffs for normal or healthy blood pressure on their website. So as you can see, for most adults, normal or healthy blood pressure is 120/80. But higher blood pressure targets may be used for people who have hypertension with a 10% or greater risk of heart disease over 10 years, which might include people who already have heart disease, kidney disease, or diabetes. And as you can also see on this slide, stage 1 hypertension happens when you have blood pressure readings of 130/80 or higher. And stage 2 hypertension occurs when blood pressure readings reach 140/90 or higher. So the American Heart Association recommends reaching out to your doctor once your blood pressure readings reach hypertensive levels, stage 1 or stage 2. Specifically, they want you to talk to your doctor about healthy behavior change with recommendations seen on this slide. And then you might also be asked to take antihypertensive medication. So if you have stage 2 hypertension, medication is recommended, but it's also recommended if you have stage 1 hypertension with comorbidities of heart disease, kidney disease, or diabetes. Now, unfortunately, studies with patients show that they have limited knowledge and that undermines their blood pressure control. For example, a study conducted across 76 European health centers found that 49% of European patients on antihypertensive medication did not know target blood pressure readings, and that was associated with worse blood pressure control. Now, there's a limitation to studies with patients because they don't include people who do not yet have hypertension, but may develop it in the future. Those people also need to have good knowledge about what constitutes normal or healthy blood pressure readings. Also, surveys that test people's knowledge about blood pressure also do not typically include measures of confidence in knowledge. And studies in judgment and decision-making have shown that confidence is important for informing our decisions to act or not to act, independent of actual knowledge. Confidence gives us the security to act or not to act and make decisions about that. So in this study that I'll be presenting today, we asked what percent of participants in a nationally representative sample is confident and knowledgeable about blood pressure. And then we also look at whether being confident and knowledgeable is associated with intentions to seek care for different blood pressure readings. So we conducted our survey with a nationally representative online survey panel recruited through Understanding America study, which is a study run at USC. The sample is nationally representative. They are recruited through random address-based sampling. And then underrepresented populations are especially targeted, and people receive internet access and a tablet if they don't have it to ensure the representativeness of the panel. Our particular sample included 4,400 people without hypertension, 1,300 people with hypertension alone, and 795 people with hypertension and comorbidities of heart disease, kidney disease, or diabetes. The question about confidence asked, how good are you at understanding blood pressure numbers? Participants could answer very good or good, which was treated as being confident, or they could say not that good or not good at all, which was treated as not confident. And dichotomizing this measure had no effect on our findings. Participants were also asked about their knowledge for normal or healthy blood pressure readings. They could give a number for systolic and for diastolic blood pressure. The systolic is usually the first number and diastolic the second. Or they could say that they didn't know. Only answers between 130 and 130 for systolic and at 80 for diastolic blood pressure were treated as correct. If we only treated 120 over 80 as correct, it hardly affected our findings. And intentions to seek care were asked by a question that asked if your blood pressure readings were at one of these three specific levels right now, how likely would you be to reach out to your doctor about better controlling your blood pressure? So participants were randomly assigned to one of those three readings on this slide. The first one reflects to stage 2 hypertension blood pressure readings. The second reflects stage 1 hypertension blood pressure readings. And the third one reflects normal or healthy blood pressure readings, which the American Heart Association actually recommends that you do not reach out to your doctor for, because you don't need to control your blood pressure when it's that good. So we treated that as a comparison group. And then participants could answer likely or very likely, which was treated as expressing intentions to seek care. And the other two answers were treated as expressing intentions to not seek care. That too did not affect our findings. So let's look at the first research question. What % of participants is confident and knowledgeable about blood pressure? So on this slide, you see that in our overall sample, 64% of people said that they knew how to interpret blood pressure readings. However, only 39% of people in the overall sample actually knew that normal or healthy blood pressure is between 120 and 130 for systolic and at 80 for diastolic blood pressure readings. Now, if we use only 120 over 80 as the correct answer, then 36% of the overall sample gave the correct answer, so it hardly made a difference. Then we also wanted to know whether being confident and knowledgeable was associated with intentions to seek care for different blood pressure readings. On this slide, you see that generally, participants were more willing to seek care for stage 2 hypertension blood pressure readings, reflected in the red bars, and for stage 1 hypertension blood pressure readings, reflected in the orange bar, compared to the green bars, which reflect willingness or intentions to seek care for normal or healthy blood pressure readings. And of course, we wanted to look at the role of confidence. And on this slide, you can see that confident people were saying that they were more, they expressed that had a greater likelihood of expressing intentions to seek care for stage 2 hypertension. However, for stage 1 hypertension, confident people were less willing to seek care as compared to people who were not confident. And that's sort of in line with what we found for normal and healthy blood pressure readings as well. So confidence only increases intentions to seek care for stage 2 hypertension blood pressure readings. We also see this in logistic regressions. So confidence increases intentions to seek care for stage 2 hypertension, decreases intentions to seek care for stage 1 hypertension, and actually has no effect on intentions to seek care for normal or healthy blood pressure readings, where knowledge is the main driver of intentions. These logistic regressions, by the way, control for demographic variables, and knowledge and confidence only show moderate correlations. So overall, we conclude that confidence is a key predictor for intentions to seek care for stage 2 hypertension or not seek care for stage 1 hypertension. Overall, if we want to promote hypertension care seeking, we should try to increase people's confidence in correct knowledge about what constitutes normal or healthy blood pressure, and so that people feel confident about seeking care when they need it. Thank you very much for your attention. And please don't hesitate to get in touch.